When her husband needed to see a doctor quickly, Marjorie Montgomery paid for a virtual medical service.
I thought, well, all right, then I'll just pay the $55, and because I need something immediate.
But it took several attempts to reach a doctor, and she doesn't know how much she'll be billed. The idea that anyone in Canada should have to pay anything for essential care got pushback in Ottawa.
There should be no fees for medically necessary health care services, wherever people may live in this country.
The federal health minister says Canadians paid more than $80 million out of pocket in the 2020-2021 fiscal year to access services like ultrasounds, MRIs, and CT scans that should be covered by Medicare. Now, the government is cracking down, deducting a total of $82 million from some provinces' federal health transfers. BC will be down $17 million, and Quebec will lose the most money, nearly $42 million. Quebec Health Minister Christian Dubé says he's disappointed. The province did not get as much money as it wanted in the recent federal health agreement. Now, Dubé says Ottawa is taking money away. And the federal government says if provinces keep letting private companies charge patients for health services, their transfers could be cut back even more.
Helping the public understand that being charged for medically necessary care is not acceptable.
This health policy researcher says medical fees create inequities, violate the Canada Health Act, and can put patients in a vulnerable position.
It's a very exploitative practice at a time when people are in pain and they are looking for answers.
But this expert says banning fees is not enough when there are issues in the public system that push people toward private care in the first place.
Many Canadians don't have a family doctor, that when they need an appointment, they can't find one, even if they have a family doctor. Walk-in clinics are not accessible. They're waiting in lines. They're going to the Emerge, waiting hours and hours.
And Alison, the health minister, also mentioned he's concerned about virtual care.
Yeah, the federal government says although there have been good advances around virtual care where people can see a doctor online, that's also opened the door to more people accessing that care for pay through private companies. And the federal government has written to the provinces urging them to ensure that people don't have to pay for medically necessary care that they need online. And that could be another area where provinces can see their federal health transfer payments reduced.
All right. Alison, thank you.
You're welcome.